Welcome class to MED 130, Chapter 4, Interpersonal Communications. So what I need for you to take away from this particular chapter is we have to simply use good manners and good communication. It's vital in the care of your patients, the activity between teammates, in your actual office or specialty practice that you're in. We have to learn to understand we're all different. Okay, so let's get started. On page 45, it talks about, do you remember the last time you had a medical appointment? It just gives it a little scenario. And do you recall, were you greeted with kindness, or were you greeted kind of in a rush manner, like someone really didn't care and you were just a number, that sort of thing? We don't want to train that way. Even on our worst days, we want to put on our best behavior and best communication skills, meaning body language, the words we choose, the words we don't choose, the tone, facial expressions, a lot of things we have to play into the concept of proper communications. Okay, so and you think about it, if you had to wait a long time as a patient, isn't that the most frustrating thing that you've ever encountered? You feel like you're not validated, nobody cares, you're sick and you're sitting in a waiting room full of other sick people or other people who are agitated who are waiting as well. So we all have to consider on our end as professional medical assistants how we can better communicate with these people and make their visit as pleasant as possible. Okay, so the medical assistant must be able to communicate with each patient with professionalism and diplomacy, meaning treat everyone equally, whether they're of a different culture, whether they're angry, whether they're old, they're young. There's a lot of different things that you will encounter in the medical field, and you have to be able to switch up your role to be appropriate at all times. And I know we all have bad days, don't get me wrong, but we have to keep our bad days, to ourselves and share those with, that can help us get through it, whether it be family, friends, even sometimes your coworkers. But we don't want to rely on our patients to hear, our frustrations, because they're there for your help and the physician or provider's help. So we move a little further to page 46. As you communicate with patients and their families, you'll be responsible for giving information and your teammates to make sure there's an understanding. So we just can't babble off some medical jargon and expect that patient or staff member or non-staff member to understand us. So we have to find the appropriate communication skills and word usage and verbiage to communicate effectively. It all depends on who we're talking to and the situation. The communication circle. And where this begins is three elements: the message, a source, and a receiver, meaning I am the person or the sender of a message to you in this lecture. And the message is my lecture, and you are the receiver. I'm sorry, I'm losing my thought here for just a moment. It just feels different when no one's sitting in front of you, folks, so please bear with me. Thank you. So feedback is essential. You're the person who's listening to my lecture or my message, and the feedback is when you test, you get something right, that feedback tells me I presented it to you effectively. Does it mean we're perfect, I'm perfect, you're perfect? No. But the feedback gives me an idea of what I need to change or additional information that I need to provide. And that's included in the communication cycle with our patients and coworkers and patient families. I don't want to forget those. They're an important part of the communication cycle as well. Noise. Oftentimes there's a lot going on in the office, ladies and gentlemen, and that can be frustrating, difficult. Like right now, I've got everything turned off in the house. I can hear some background noise outside, but it's a peaceful noise. But please rest assured, in the physician's office, it's not usually quiet, nor are you working in an area that is completely noise-free. So we have to learn to stabilize ourselves, but focus on our communication or our skill or our, whatever we're doing that day, and try to block those outside noises and sometimes frustrations. We have to block them out, but we have to block them appropriately. A ringing phone, a talking patient, a talking provider behind you, that's going to happen. But we need to learn to, okay, what needs to be done first? Does that phone need to be answered? Do I need to answer the physician so he can get back to the patient? Or do I take care of the patient in front of me? And all of that depends on our critical thinking. We've got the patient checking in. Could you hold for just a moment while I answer the phone? Provider, is this emergent? Or can I get this phone call and place them on hold, please? Do you see where we have to triage our situations oftentimes, because there is a lot going on in a physician's office at any given time? And human behavioral needs, the developmental stage of the life cycle. Understanding growth and development will help you to enhance your skills, including educating your patients from all age groups, cultures, and religions. This growth includes physical, psychological, and emotional. And ladies and gentlemen, remember, some of us do not develop all at the same time, meaning in maturity, there may be some medical issues, there may be an age situation, there may be a cultural thing. So we have to learn to adapt effectively to communicate with everyone. So we turn on over to page 48, and that talks about Maslow's hierarchy of human needs. And his name was Abraham Maslow. He was a human behavioralist who developed a model that he has called the hierarchy of needs. And what I need for you to know, the peak or the ultimate goal in that pyramid is self-actualization. And if you read that a little further, it goes into each stage and explains those, okay? But if you have questions, please reach out to me. Types of communication. Positive verbal communication, that's please and thank you, or repeat what they told you back to them to clarify. It's having manners, it's having good smile on your face, good eye contact, a show of true concern for that patient's question, concerns, issues. We're not taking sides, but we're being a good listener. Okay? And be friendly, be attentive. And I tell all of my students, please, please, please try to avoid sympathy, okay? Oftentimes sympathy can turn the patient into, hey, that medical assistant's feeling sorry for me and I'm already bad enough. Does he or she know something I don't know? And they start to have more self-pity and more anxiety and more worries and concerns. So the key term here I want you to take away is empathy, putting yourself in their shoes without judgment, without making any unnecessary, I'm so sorry you're sick, I'm so sorry about the diagnosis. Instead, I understand your fears, but the provider is available to help you understand your diagnosis and to help you with the treatment plan. We just have to be confident at all times. We can't give any cues that we know anything in that chart is bad or good, because at the end of the day, it's the provider's responsibility to give them information, bad or good. We would only do that in the event the provider has asked us to do so, meaning this lab is abnormal. The medical assistant, hey, can you call this person and tell them it's abnormal, but I am calling them in a supplement to help get it back to normal, and we'll repeat the labs. So as long as you are instructed to do so, that's fine. But nothing in that chart is to be communicated through you without the authorization of that provider, other than information that you're capturing to make certain you're repeating it back to them to make certain it is correct and accurate. Nonverbal body language. If someone's sitting here like this, staring at their phone, when you go check in, do you feel very welcome? Absolutely not. Sit up tall, be confident, smile. Hey, how are you today? Can I help you? And, always keep a positive attitude. We don't have to be overly nice, but be confident and be friendly. Be professional. Facial expressions is everything. If someone's rolling their eyes at you, doesn't that cue you that they really are not interested, or I just said something they don't like? And that's a bad, bad, bad thing to do. Or a frown or a stare. Does someone just stare at you at the medical office and you just feel so stupid? Don't do that. Make eye contact, but don't stare. And, nod your head that you're listening. Don't look over here at the computer and look at the wall and grab out your phone. Be professional and keep that communication line open. Open posture, a feeling of receptiveness and friendliness, meaning if I had my arms crossed sitting on my stool staring at you, that's telling you I do not want you in my space and I really am not interested in anything you have to say. And that's pretty sad because there are people in the medical field that do that. And I don't want you as students, professionals that are working toward a degree to go out there and be that way. Be the good person, be the professional. Closed posture conveys the opposite of open, a feeling of not being totally receptive to what is being said. It also can signal someone is angry or upset. You just kind of sit there looking at the patient. That just tells them you're showing no interest. Like you're waiting on 5 o'clock and you don't care what they've got to say and I'll get the doctor right in. Take time and be patient with your patients and be polite and have a good communication skill set at all times. Because just when you think someone's not listening or looking, they are. Remember that, okay? All right, touch. It's okay to put your hand on someone's shoulder. Hello, Miss Smith, can I take your blood pressure? Don't go in and hug and love and do all these things with these patients. That is, you're getting into their personal space and then you're putting them in your personal space. I highly do not recommend that. Now, if you know that person and they reach out to hug you, I'll let you make that decision. But in the office, please keep that fine line between personal and professional separate. Because legally, you cannot cross that line and go home and tell someone about their lab results or tell someone who someone was in that office that day and what they were in for. It is called confidentiality, and it can get you in a lot of trouble. So you must draw that fine line. Even if it's the neighbor, I would treat them as I treat every other patient, avoiding the hugs and the personal chats and everything, because it builds rapport. And then that person believes I can get anything I want from this medical assistant because she's my neighbor. I gave her a hug. We chit-chatted. Stay professional, everyone, at all times. Personal space, that's what I was just talking about. If we are sitting in front of one another, there is a fine line. Beyond arm's reach, leaves plenty of space, for communication. Unless that person can't hear, I understand moving a little closer, but there is a personal space and you need to find that with every patient. Listening skills. We must listen carefully. Oftentimes patients do not understand your question, so their answer comes out way apparently backwards, okay? Take the time to explain. No, Miss Smith, I meant to ask you this. Don't make them feel like they're not smart or don't understand. Just help them along the way. I meant to say, Miss Smith, is it your left leg or right leg? Just something simple. Keep the communication open. Listening can be passive or active. Passive is hearing what someone says without the need to reply. Active is I've heard what my patient said. Now I need to respond. Simple enough. Interpersonal skills. When you make a patient feel at ease, and ladies and gentlemen, we're on page 51. I'm sorry. I kind of get off on my lectures and I lose my reminder of telling you where I am. So my apologies. Page 51. When you make a patient feel at ease by being warm and friendly, you are demonstrating, you are actually acting out, on purpose, interpersonal positive skills. Okay? Warmth and friendliness. A friendly but professional approach, a pleasant greeting, and a smile gets you a good start with your communication. Meaning, hey, how are you today? And I know that's a bad question at a doctor's office. I get it. But it may open up the communication to say, I'm not feeling well at all today. So you already know what to expect once you get to that room or once you start that interview with tell me what's going on today. So I can provide the provider with the information so that when he comes in, he'll understand what's going on. Okay? Respect. Always respect your patients. It is not Miss Lucy. It is not Mr. John. It is Mr. Smith, Miss Smith, unless they otherwise tell you, I want to be called Miss Jane. Okay? Otherwise, when it comes to children, you may want to call them by their first name, but always follow your office protocol. Okay? Genuineness, excuse me. Be yourself. Be true to yourself. Treat others as you want to be treated. That is all we're looking for. And your provider's looking for, your family of the patients and your coworkers. They're looking for being genuine, being yourself. Don't be the devil in the break room and then come out and put this fancy fake smile on and push yourself forward. You have to be genuine and true to yourself. You cannot fake this profession, okay? Assertive skills. When people are aggressive, they try to impose their position on others or try to manipulate them. We don't want to be aggressive with anyone. We don't want to stand over the top of that patient while we're asking questions. We don't want to get in their personal space and be aggressive at the same time. But to be assertive is different. It's trying to impose, you must be open, honest, and direct, meaning, Miss Smith, I am Lisa. I will be your medical assistant today. Can you tell me where the pain is? Can you show me where the pain is? I'm being assertive with specific questions, but I'm not being aggressive. Okay, what's hurting now? What hurts this time? That's being aggressive. That's being ugly. That's being very unprofessional. Okay? All right, and then on 52, therapeutic communication. It includes being silent. Sometimes they just want to talk it out. Be a good listener. Sometimes don't interrupt them with additional questions. They may be totally overwhelmed with a situation that we know nothing about. So just be a good listener. Be an acceptor of their information. Giving recognition. Show them that you are aware of them by stating their name and greeting. Make yourself available to the needs. Giving a broad opening. Allow the patient to take initiative in introducing the topic. And for instance, is there something you'd like to talk about? Or where would you like to begin? And oftentimes, a really good sentence, and that's not to say you have to use it, but it was effective for me. What brings you in today? Not, why are you here now? There's so many different ways that question can be presented wrong, okay? Offering leads, okay, and then what happened? Add some clarity to, okay, you failed. Okay, then what happened? Okay, then what started hurting? Was there other pain beyond that? You don't lead the patient, but get as much communication and information as you can for your provider to be well prepared when he or she goes in the room to see the patient. Because you are the liaison. You are the information taker for that provider. Encourage communication. Get them to talk to you. Some will not talk to you until they get to know you. And then some are not going to talk to you at all. They have a bad diagnosis, they've had a bad run at another office or even another coworker in your office, and they feel really adamant about talking. So oftentimes do not force them, but try to encourage and get as much communication as you can. Reflecting, meaning, and I'm not too keen on some of this scenario, but reflecting to me is the patient will say, well, should I just tell the provider that information? And I would not say, do you think you should? I would simply say, do you feel it's important for him or her to know? Sometimes these textbooks need a little tweaking, with opinions, and that's just my opinion. It may be that you approach it that way, but my effective feeling about that would be, do you think it's important to him and her, the provider? If so, yes, definitely let them know. Roadblocks, oftentimes patients are mad. They don't want to be there. They've been sitting there waiting. They're already angry. They're sick. So we have to learn to open up that positive atmosphere. Don't go in laughing and joking and talking, but just go in with a positive attitude. You've kind of looked in the chart. You know what's going on. It's a bad diagnosis. We cannot, again, tell that patient anything without the provider okaying us to communicate. So just be calm, be accepting, and be effectively communicating with the patient. Sometimes less questions is better. Keep it to the point, keep it simple, get all you need from the patient, and have them prepared for the provider. Because oftentimes he or she, the patient, will tell a lot more to that provider than they'll ever tell you. And don't feel offended by that. It's just some folks feel more comfortable talking to that provider only. Okay. There are also defense mechanisms. There's compensation. There's denial. Why do you ask if my back hurts? My back doesn't hurt. I don't know why I'm here. They're going to be in denial, and that patient may even have a tumor on their spine. And no, there may be no symptoms, but you may simply say, I still have to ask these questions in preparation for your visit today with the provider. So if you will, we'll just go through these few questions. If it's yes or no, if they're all no, it's fine. I just need to ask you for the provider to be prepared for your visit. The anxious patient, the angry patient. There's all kinds. Like I said at the beginning, there's all kinds. We have to learn to be receptive. Anger breeds anger. So you getting angry with that angry patient is not going to be a win-win situation. The anxious patient does not need for you to hug or love on him or her, but just be confident, stay calm, and communicate effectively. There's language barriers. There are some in the offices who are bilingual, which is wonderful, but oftentimes we need to learn to help those patients and find that coworker that can help translate. And then, of course, limited reading skills. There are some who cannot read and write. Do not embarrass those patients. Please just be friendly, be professional, and sit down with them and help them fill out the forms if there's forms to be filled out. And, just explain to them, but also make notation in your chart. You and your credentials, fill this out for patient per the request due to inabilities to read or write or both. Be professional when you document. Okay. Terminally ill patients, they'll go through all kinds of stages of ups and downs. We just have to be accommodating and be professional at all times. We cannot give them false hope. I know you're going to be fine. You're going to get better when it's a terminal cancer thing. So don't tell them false hope. Just be yourself each time. Stay calm. Sometimes less is better. And just do your intake or your interview as you always would, regardless. But some will talk to you about it. They'll become very open at times in some of the stages of these terminal illnesses, and they want to just talk your head off. Be that good listener. But don't offer any false hope. Don't offer, well, have you tried this new treatment? Don't do any of that. Just be yourself, be a good listener, be a good communicator, be an understanding, professional person. There's some with behavioral health issues. There's mental illnesses, there's drug addiction, there's alcohol addiction, there's all kinds of things that you're going to see. And again, you just have to be professional. At the end of the day, regardless of the circumstances, being professional. Gender identity and sexuality. There are intakes where he may look like a guy, but he is a girl, and vice versa. Be professional. Look on their intake to see what they have marked, or they marked on their paperwork, or past information that's been sent to you, or just simply ask, do you identify as, or what gender do you identify? Be professional, be non-judgmental, okay? Because they do not want to be called Mr. when they're Mrs. or vice versa. So just be able to handle it effectively. Communicating with management, 58, always be respectful of your management. They are your peers. They are your help. They are your go-to people when there's issues. But if there's issues that you can resolve within your teammates, that's the best action plan. But at all times, keep your supervisor informed. If you had a patient that's give you a hard time and you've documented, keep that supervisor informed. Don't run to him or her every time something happens. But if you feel it's an ongoing, legitimate issue, report it so that something can be done. It may not be kicking the patient out. It may be simply putting another medical assistant or another staff member with that patient when they come in each time. Everyone doesn't click, but that doesn't mean run tattle. We're not children, we're adults, on little nitpicky things. But if it's legitimate and you feel it's legitimate, make time, ask the supervisor, when can we sit down? I have a concern. And then, he or she will handle things appropriately, and communication is open. So if you have any questions, please don't hesitate to reach out to me. And I hope you all have a great day. Thank you.